And the floor is yours.
All right, thank you. So the presentation that me and Tanya have worked on is, of course, infectious diseases and what it means as we get older. As I was doing the research for this, I tried to keep it from reputable sources to make it as true as possible. I hope that you enjoy. Okay, so today we'll be discussing an introduction, some of the definitions that will show up as I go through this presentation, changes to the immune system as we get older, a section on COVID-19, intro- introduction to the most common infectious diseases for individuals 65 and older, vaccines, our first line of defense, good hygiene, the primary way to prevent infections, and then a conclusion statement. So this presentation will be an insight into various topics pertaining to infectious diseases that primarily affect us as we age, and the risk factors that are involved with an aging immune system. So for some of the common definitions that you'll see throughout this presentation, of course, infectious diseases caused by pathogenic microorganisms such as bacteria, viruses, parasites, or fungi. They can be spread from the environment or from one person to another, resulting in illness in our communities. Next will be epidemiology, the branch of medicine which deals with the incidence, distribution, and possible control of diseases and other factors relating to health. Pathogenic, of bacterium, virus, or other microorganisms causing disease. Microorganism, a microscopic organism, especially a bacterium, virus, or fungus. Virus, an infective agent that typically consists of nucleic acid molecule and protein coat, is too small to be seen by the light microscopy and is able to multiply only within the living cells of a host. Definitions continued. Bacterium, a member of a large group of unicellular microorganisms, which have cell walls but lack organelles and an organized nucleus, including some that can cause disease. A parasite is an organism that lives on or in a host organism and gets its food from or at the expense of the host. The three main classes of parasites that can cause diseases in humans are protozoa, helminths, and ectoparasites. Immune system, a complex network of cells, tissues, organs, and the substances they make that helps the body fight infections and other diseases. The immune system includes white blood cells and organs and tissues of the lymph system, such as the thymus, spleen, tonsils, lymph nodes, lymph vessels, and bone marrow. And geriatric, relating to older people, especially with regard to their health care. Next, we'll be discussing changes to the immune system as we age. So how does the immune system change with age? Older people, the immune system becomes less able to distinguish self from non-self. That is to identify foreign antigens. As a result, autoimmune disorders become more common. Macrophages, with ingest bacteria and other foreign cells, destroy bacteria, cancer cells, and other antigens more slowly. So next we'll be talking about some of the different systems in the body and how the age of those systems plus the aging of the immune system can result in us not being able to fight off illness as well as we could previously in our life. So the cardiovascular system, the most common change is the system is stiffening of the blood vessels and arteries, causing the heart to work harder to pump blood through them. Ways that you can help to prevent this or lessen the risk include physical activity, eat a healthy diet, don't smoke, manage your stress levels, and get enough sleep. Next is the musculoskeletal system, or bones, joints, and muscles. With age, bones tend to shrink in size and density, weakening them and making them more susceptible to fractures. Muscles generally lose strength, endurance, and flexibility, factors that can affect coordination, stability, and balance. Ways to help this: get adequate amount of calcium, get adequate amount of vitamin D, include physical activity in your daily routine, avoid substance abuse. The next up is the digestive system. Age-related structural changes in the large intestine can result in more constipation in older adults. With common constipation in older adults, the bacterial levels inside of the intestines in the gut the good bacteria starts to lessen, the bad bacteria starts to increase, and this is where we can get infections. Contributing factors: lack of exercise, not drinking enough fluids, low fiber diet, and some medications can be prescribed. How to help this: eat a healthy diet, include physical activity, don't ignore the urge to have a bowel movement. Bladder and urinary tract. The bladder becomes less elastic as we age, resulting in the need to urinate more often. Contributing factors is being overweight, nerve damage from diabetes, certain medications that may be prescribed to you, caffeine or alcohol consumption. How to help: get to the toilet regularly, maintain a healthy weight, don't smoke, avoid bladder irritants, and avoid constipation. The next slide is on the coronavirus. I did not spend a lot of time on coronavirus. We currently are all facing this pandemic and all the changes that go along with our day-to-day lives. We've all seen the media coverage of it. We've all read an ample amount of literature on it. So I didn't want to go too deep into it. But when discussing infectious disease, not only as we get older, but at any age, this right now is priority number one to try to get over and conquer so that we can all go back to normal and not have the concern of this virus and if we may catch it. So the definition is an infectious disease caused by a newly discovered coronavirus. What happens if infected? Most people infected with the virus experience mild to moderate respiratory illnesses and recover without requiring special treatment. This, of course, is in young adults with a very strong immune system. And in that age demographic, we don't tend to see too many serious complications from coronavirus. But again, as we age and that immune system weakens, this is when we are open and more susceptible to some serious complications or even hospitalization. Older and immunocompromised are more likely to develop a more serious illness. Myself, I suffer from Crohn's disease, which it makes me immunocompromised. So right now, even as I age and having to worry about my immune system weakening, on top of that, I also have to be very careful because I am immunocompromised. Now, ways to prevent this is being well informed about the virus. As I said previously, we've all seen the media coverage and we've all read the literature that's been all over the internet and magazines and newspapers. The disease it causes and how it spreads. So that's person to person transmission, of course, through saliva, through in touching an infected surface, and then touching your face. Wash your hands or use alcohol based hand sanitizer frequently and do not touch your face. Of course, along with that is wearing a mask. How it spreads. Droplets of saliva or discharge from are discharged when an infected person coughs or sneezes. Always practice respiratory etiquette. Example would be coughing into a flexed elbow or into a napkin. This is also why it's so important that we wear masks during these times. So next, I'm going to go into some of the most common infectious diseases that individuals 65 and older face. This is just kind of an introduction into those infectious diseases. So infections are a leading cause of death in adults over 65. Common infections like influenza and UTIs can happen to anyone. But for adults over the age of 65, these illnesses may be much harder to diagnose, leading to chronic poor health, ongoing discomfort, and a higher risk of hospitalization. In fact, 1/3 of all deaths in seniors over 65 results from infectious diseases, according to the American Academy of Family Physicians. Those seniors are more susceptible to infection overall. Seniors with dementia or those who are in long term care may be at even greater risk. So, for somebody who experiences dementia, it's not as much to do with a weakened immune system as they age, as much as it can be that they have forgotten to take medications, they forget to wear a mask, for example, right now, or that they may forget personal hygiene. Bacterial pneumonia is probably the most common in individuals over 65. It's something that I'm sure we have all heard about, and it's something that we've come to learn can be very serious if not treated immediately. So, more than 60% of seniors over 65 get admitted to hospitals. Reasons why seniors are at greater risk is changes in the lung capacity, increase in exposure, especially for those that are in long term care facilities, and increased susceptibility. The classic symptoms of bacterial pneumonia, less frequent in elderly, however, are chills, cough, and fever. Now, your non respiratory symptoms that you would have to look out for are things like confusion or delirium, sharp or stabbing chest pain that worsens with breathing heavily or when you cough, a loss of appetite, low energy, and fatigue. So the next most common is elderly influenza. So I've just received a question. It's a great question. It says, how do you bring up your immune system? I see on my blood tests, usually the cell things are very low, and you have had 9 operations with no problem in the past few years. So when it comes to the immune system, as we age, it's going to weaken. It's inevitable. We can't really avoid that. However, by taking care of yourself in terms of personal hygiene, diet, exercise, as well as, say, supplements like vitamin C that can boost the immune system, they will help you. In terms of if you were very concerned with it and it was something that you wanted to speak to your physician about, that's something I would recommend. They may have some better advice for you than I do. So, elderly influenza. So, we all know there's a flu season every year. We're urged to get our flu shots. This is most of the time not a big deal. But as we get older, this can become a big deal because of that weakened immune system. So, influenza and pneumonia combined add up to the sixth leading cause of death in America. 90% occurs in seniors, and some of the causes is the weakened immune system, and other chronic conditions. Like I said myself, with Crohn's disease. Other causes are, of course, lack of personal hygiene, touching infected surfaces such as doorknobs, phone screens, and then touching your face. And the ways that we can transmit this to someone else or someone else can transmit it to us is through coughing, sneezing, droplets when talking, touching a surface or object that has the virus on it, then touching your own mouth, nose, and eyes. So some of the symptoms of influenza are fever or feeling feverish and chills, sore throat, runny or stuffy nose, muscles or body aches, headaches, fatigue or tiredness, and some may have vomiting and diarrhea. The treatment for influenza is antiviral drugs to help it make it milder. There are 4 FDA approved influenza antiviral drugs, as you can read here. I apologize, the pronunciation is something that I'm not sure that I can do. So next would be elderly skin infections. So due to the changes of our skin and its ability to resist disease as we age, skin infections are more common. Here are the more common ones: bacterial or fungal foot infections, more common with those with diabetes, cellulitis, drug-resistant infections like MRSA, and viral infections like herpes zoster or shingles, and pressure ulcers. Symptoms to look out for: unusual itching, lesions or pain, pus or fluid leaking out of the cut, red skin around the injury, swelling, and a fever. So when to seek treatment: fever of 100.4 degrees or higher, if you are in a significant amount of pain, and if the redness or swelling begins to spread away from the area in question. So next would be gastrointestinal infections. So age-related changes to the digestion and gastrointestinal flora put seniors at increased risk of developing these infections. So the most common or Helicobacter pylori or H. pylori and Clostridium difficile or C. diff. Now, sometimes you may see that long-term care facilities or even some hospitals end up with kind of an outbreak of these two specifically. And some of the causes are antibiotic treatments that suppress healthy gastrointestinal flora. So depending on what medications you're prescribed by your doctor, these can suppress some of that good and bad bacteria in the gastrointestinal tract, which then makes us a little bit more susceptible to these two common gastrointestinal infections. Viruses is another one, and parasites, of course. So symptoms to look out for is a high fever. Now, in any infection, a high fever is always going to be your body's way of kind of telling you immediately that there's something wrong. Bloody bowel movements, vomiting, abdominal cramping, and diarrhea. Urinary tract infections, or UTIs. UTIs are the most common bacterial infection in older adults. Use of catheters or presence of diabetes can increase the risk of UTIs. Things that you should look out for is a sudden change in behavior or confusion, worsening of dementia, onset of urinary incontinence. Now, these four symptoms and the things that you should look out for are very much so on the more serious side of possible symptoms. Now, as we age, when we get some of these infections, discomfort and pain don't necessarily happen in seniors. It seems that other symptoms can present themselves. Some of them can be worse than they were, say, when you were in your 20s, but pain seems to be one of those things that dissipates as we get older. Now, if a UTI is expected, of course, have a physician perform a urinalysis or other testing to confirm. He will then likely prescribe to you antibiotics in order to help fight the infection. And for those in that are caregivers, whether it be in home or in long-term care facilities, they should always make sure their loved one or their client drinks plenty of water to help with the UTI. The body has very few ways in order to get rid of infection out of the body, and one is through urine. So the higher the intake of water and the more frequent that you have to urinate is a way that you can speed up the healing or speed up a way that your body can purge this infection. Now, how to prevent a UTI? Of course, again, drink plenty of liquids, especially water. Changing incontinence briefs frequently. Avoiding bladder irritants such as caffeine and alcohol. By keeping the genital area clean by wiping front to back. And urinating as soon as the urge hits. If you hold in the urge to urinate, the longer that the urine stays within the body, it gives bacteria an increased chance of growing. So if you feel like you have to go immediately in order to try to keep all of this system clean as much as possible. Now, this next slide is vaccines are first line of defense. So vaccines are especially important for older adults. As you get older, your immune system weakens, and it can be more difficult to fight off infections. You're more likely to get diseases like the flu, pneumonia, and shingles, and to have complications that can lead to long-term illness, hospitalization, and even death. Now, I don't mean to panic anyone. Again, death is a very serious complication of any of these infections that I've talked about today, but the risk is still there, and this is why it is so important to take care of yourself and to make sure that we are aware and educated and always in the back of our minds that this idea that washing your hands is especially important. If you have an ongoing health condition like diabetes or heart disease, getting vaccinated is especially important. Vaccines can protect you from serious diseases and related complications, so you can stay healthy as you age. Of course, again, going back to coronavirus, Okay, so I'm just going to take a second here and answer another question that I've received, which is how much vitamin C every day? So when you buy the supplement of vitamin C, it will tell you if you're taking the supplement, how much you should take of that supplement. Now, our body does produce its own vitamin C through some of the foods we eat, such as oranges and things like that. Generally, I could be mistaken, so don't quote me, but I believe it's 2,000 UI a day. Now, also, is turmeric good? Uh, Turmeric does have antimicrobial properties. It certainly would be something if you like the spice to add it to your food in order to give you that little boost that you may be looking for, certainly. And the last question would be the difference between a bladder infection or a urinary tract infection. So a bladder infection is only going to affect the bladder. It doesn't generally transfer into the urinary tract, which goes from the bladder to outside the body. Now, if you had a bladder infection and you did not seek medical attention and that did get worse, then yes, certainly you could also end up with a urinary tract infection as well. Okay, so back to the presentation. Uh, so getting vaccinated can help you, your family, and your community stay healthy. Of course, especially again going back to Corona, because it is the most prevalent thing in our community right now. Getting vaccinated, you can see how important it would be. It not only to protect yourself, but your family. And as we can see, as cases rise, clearly community is being affected as well. And vaccines have been around for a long time. They're very well tested for the most part. And we have seen with just our regular vaccinations that we get, such as mumps, measles, rubella, polio, rabies, things like that, that we have brought the numbers of these infections down to a point of almost eradication. And that has largely in part to do with vaccines. So next will be good hygiene, the primary way to prevent infections. Now, as I go through this slide, likely everything I'm going to tell you is common knowledge. It's just kind of a refresher and a reminder that these are, kind of your first line of defense against infection. So the first thing to practice is to keep germs at bay by following good personal hygiene habits. Prevent infection before it begins and avoid spreading it to others with these easy measures. So, of course, wash your hands. Cover a cough or sneeze. Wash and bandage all cuts. And do not pick at healing wounds or blemishes or squeeze pimples. If you open the skin or you take the scab off of any of those wounds, you are now taking away the body's defense from bacteria. Don't share dishes, glasses, or eating utensils. Avoid direct contact with napkins, tissues, handkerchiefs, or similar items used by somebody else. So finally, I'm going to go through a conclusion statement. And within this conclusion statement, there was an analogy I was told several years ago that kind of has always stuck with me. And I think it's the easiest way to describe the immune system and what happens as we age without kind of all of the scientific jargon that goes along with it and sometimes can confuse us. So, as the world is learning to become more aware of how life altering a virus can be when it reaches pandemic proportions, It is imperative that as we age, we remember to practice simple things that can protect ourselves, our loved ones, and our communities. As we continue to navigate through this COVID-19 pandemic, we can see that wearing a mask, social distancing, and practicing proper hygiene has made a difference in terms of significantly reducing and arguably eliminating the yearly flu season. These same practices can be applied to our everyday lives to help reduce our risk of contracting some of the common infectious diseases that I have spoke about today. I was told many years ago an analogy that still stands true to this day that helps simplify some of the information I discussed today, and that was, imagine the immune system as if it was a brick wall. And as we age, bricks begin to be removed from that wall. The older that we get and the more bricks that are taken out of that wall makes it very easy for objects to then pass through that wall, as well as weakening the structural integrity of the wall. That analogy, in short, can be directly applied to our aging immune systems as well. Thank you for your time, and I hope that you have gained a new insight after hearing my presentation.
Thank you so much, Kyle. That was a great presentation. So thank you, Tanya and Kyle. So as I've mentioned before, Tanya Forget is our student placement and who created the, well, her and Kyle did the presentation, and Kyle's the one who presented it to us today. So again, thank you both very much. This was a really good presentation, a lot of information. Was there anybody who had any other questions for Kyle today? Oh, there's one. Oh, it says you were amazing. Thanks.
Thank you very much. I appreciate it.
Yes, it was very well done. Okay, perfect. So again, thank you so much. You guys did a great job. Great job presenting it, Kyle. Thank you. Judy Haynes says thank you as well.
Thank you. I appreciate it.
Oh, and say hi to your baby. I hear a baby in the background.
I escaped the room for a couple minutes because she was fussing. So
Yeah, you will do that. Elaine says thank you and great job.
Thank you. I appreciate it.
Okay, so fantastic. So I want to wish everybody the rest of a good day, and we will see you guys next time. So thank you. Have a great day, everyone.
bye, Francine.
Bye. Thank you again, guys.
You're welcome.